To know the hindrance or obstacles in hand hygiene practice among healthcare workers of Qassim province of Saudi Arabia p. 52. Sanjay Kumar Gupta, Sunitha Lorin Mathias, Ibrahim Saifi Harbi. DOI 10.4103/jpsic.jpsic_16_17. Introduction. Hand hygiene, HH, is now considered as one of the most important measure of infection control activities. In the time of the growing burden of healthcare-associated infections, HCAIs, the increasing severity of illness and complexity of management, threatened by multi-drug-resistant, MDR, pathogen infections, healthcare workers, HCWs, are reversing back to the basics of infection preventions by simple measures like hand hygiene. Objectives: to find out the hindrance or obstacles in hand hygiene practice among healthcare workers. Methodology: hospital-based cross-sectional study. Observations: in the present study we asked about their opinion about hand hygiene, HH. Around 21-28% responded were fully correct. We also access their correct knowledge about WHO 5 moments/indication of hand hygiene, HH. 70-94% had correct knowledge regarding indication of hand hygiene. We also access according to their day-to-day difficulties, obstacles in hand hygiene practice. Majority of them responded often too busy or insufficient time 18-25%, followed by hands don't look dirty and skin irritation 17-23%, and 17-23%, respectively. Some people's also influenced by others' behavior because they don't practice, so we 17.56%, also responded no difficulties in practicing hand hygiene, HH, in day-to-day work. We also asked their suggestions for improvement in hand hygiene compliance among healthcare workers. Majority of them suggested encourage the staff to do hand hygiene practice every now and then. Conclusion: most of the respondents in present study were young females. Most common obstacle in hand hygiene practice was often too busy and hand don't look dirty. Common suggestion for improvement was head of unit should ask to staff's daily in morning meeting about hand hygiene compliance, and those who not follow after all these efforts to be punished.